I'm Jada Fletcher, and I will be talking about cystic fibrosis. The genetic constitution of cystic fibrosis is an autosomal recessive disorder. The recessive allele is written as little f. The observable characteristics of cystic fibrosis is the production of abnormally thick and sticky mucus in the lungs and airways. Tubes, ducts, and passageways are inflamed and plugged with mucus. This causes an individual to become more prone to respiratory infections. The cause of this disorder is through the inheritance of mutations in the cystic fibrosis transmembrane conductance regulator gene, otherwise known as CFTR. This gene encodes a protein expressed in the apical membrane of exocrine epithelial cells. The apical membrane is the surface of the plasma membrane and polarized cells that faces inward to the lumen, which consists of the cavities in the tubes, ducts, and passageways that are affected by cystic fibrosis. There are three factors that influence the severity of this disease: the nature of defect in the responsible gene, context in which the gene operates, and environmental influences. This disease of genetic epithelia is conspicuous in the lungs, pancreas, sweat, and in men, the vas deferens. Although people have been affected by and died from cystic fibrosis for thousands of years, it hasn't been discovered until the early 20th century. European folklore from the Middle Ages has stated, "Woe is the child who tastes salty from a kiss on the brow, for he is cursed and soon must die." This statement refers to the exceptionally salty sweat that is produced by someone with cystic fibrosis. It also includes the fact that most did not live past childhood with this disorder. Medical texts dating back to as far as 1595 link salty skin and damage to the pancreas with death from childhood to infants who were seen as hexed or bewitched. In 1938, American pathologist Dr. Dorothy Anderson provides the first description of the disorder in medical literature. She stated it as cystic fibrosis of the pancreas. She found such observations through the autopsies of children who seemingly died from malnutrition. Cystic fibrosis was earlier known as mucoviscidiosis. This term called attention to the presence of thickened mucus. The occurrence rate of cystic fibrosis is rare. There are less than 200,000 cases in the United States every year. There are about 30,000 people affected every year, and there's around 900 to 2,000 new cases. And one in every 3,400 births are affected by this disorder. Cystic fibrosis is most common in Caucasians of Northern European descent. 1 in every 29 Caucasians are an uninfected carrier by the mutant gene. This disorder is least common in people of African and Asian descent. This diagram shows the difference of the trachea in someone with cystic fibrosis versus someone without it. The muscle lining the trachea is thickened and inflamed, already causing a smaller passageway. There is also an increasement of thick mucus secretion that lines the muscle and creates an even smaller passageway. Many symptoms occur in someone who has cystic fibrosis. There's pain in the abdomen, burning chest, a chronic cough with blood or phlegm, diarrhea, fatty stools, severe constipation, or bulky stools. There are many respiratory problems, including pulmonary hypertension, shortness of breath, sinusitis, and wheezing. There is a delayed development in puberty and slow growth. A person is more commonly to be fatigued or have the inability to exercise. Common symptoms include acute bronchitis, deformity of nails, infection, male infertility, nasal polyps, pneumonia, salty sweat, and weight loss. Although cystic fibrosis cannot be cured, there are treatments that can ease or prevent symptoms. The pneumococcal vaccine prevents bacterial lung infection known as pneumonia. Sodium chloride can be taken by mouth or injected into the vein to treat low levels of sodium in the body. Dietary supplements such as medium-chain triglyceride can be taken. This is a dietary fat supplement made by processing coconut and palm kernel oil. There are numerous antibiotics that treat infection by potentially stopping the growth of or killing bacteria. This is a list of the antibiotics. The most common ones used are azithromycin and the penicillin antibiotic. For personal self-care, there are cough medicines available that block the cough reflex and can thin or loosen mucus, which makes it easier to clear. Postural drainage is a type of physical therapy that aids in the loosening of mucus. The chest wall oscillation is an inflatable vest attached to a machine that vibrates the chest to loosen and thin mucus. This is what the oscillation machine looks like. The machine sends waves of air through the tubes which inflate and deflate the chest rapidly. The pressure created is similar to clapping. Not only do the vibrations separate mucus from the airway walls, it moves it up into the larger airways. Typically, the vest is used for 5 minutes until the person takes a break to cough up mucus before turning the machine back on. Sessions usually last to 20 to 30 minutes. Before this vest was created, someone had to physically beat the chest or back to loosen the mucus. To recap, cystic fibrosis is an autosomal recessive disorder that causes an abnormally thick and sticky production of mucus that blocks the airways. It used to be fatal to children, but now most live to be in their 40s and beyond. It is a rare disorder. This disorder cannot be cured, only the prevention and easement of symptoms can occur. There is now a therapy procedure that helps the loosening and movement of mucus in the airways.